Hello, my friends, my family, and my fans. I am Andrew Ditch. I have been diagnosed with autism and intellectual disability. Today, I want to talk about a really important topic. This is very important for millions of other adults with autism. This topic shows how incompetent the medical and mental health field really is. You go to a doctor when something bothers you, like when physical pain, stomach problems, or even when your behaviors are not seen as the social norm. This is where I start with how incompetent doctors are in identifying autism and intellectual disability, and how they often can use masking as a way to misrepresent someone's behaviors as non-compliance or argumentative rather than part of their intellectual disability or developmental disability. How does autism and masking and competence bias make diagnostic outcomes difficult? Below is a clear, structured explanation of how autism, masking, and competence bias combine to distort diagnostic outcomes. This is one of the most important and least understood reasons autistic adults are misdiagnosed, dismissed, or denied services. I'll break it down into mechanisms, real-life examples, and why autism-specific expertise is essential. Why autism plus masking plus competence bias equals diagnostic barriers. These three forces interact in a way that hides disability, hides distress, and hides support needs, especially for autistic adults who are articulate, use technical language, or have strong verbal skills. 1. Masking hides symptoms clinicians expect to see. Masking is the learned survival strategy of suppressing autistic traits to appear normal enough to avoid punishment, bullying, or misunderstanding. Masking hides sensory overload, shutdowns, difficulty processing speech, executive function disability, social confusion, emotional dysregulation, pain, distress, suicidality. Clinicians misinterpret masking as, "You're doing fine. You don't look autistic. You seem too calm to be depressed. You're high functioning." Result: symptoms are invisible, diagnosis becomes inaccurate or incomplete. 2. Competence bias makes clinicians overestimate ability. Competence bias happens when a clinician assumes that if an autistic person can do one thing well, they can do everything well. For example, good vocabulary, you don't have communication issues. Good memory for facts, you don't have cognitive challenges. Calm tone, you're not anxious. Technical language, you're not in crisis. Articulate self-advocacy, you don't need support. Why this is wrong? Autistic adults often have spiky profiles, very strong skills in some areas, and significant disability in others. Result: clinicians underestimate support needs and misdiagnoses. 3. Masking plus competence bias equals, you're too capable to be autistic. This is one of the most common outcomes. What the autistic person experiences: severe sensory overload, difficulty with daily living, shutdowns, burnout, executive function disability, trauma, social exhaustion. What the clinician sees: polite, articulate, calm, tone, good vocabulary, eye contact, forced, smiling, forced. Result: the clinician believes the mask instead of the reality. This leads to missed autism diagnoses, incorrect mental health diagnoses, denial of services, blame, you're not trying hard enough, harmful treatment plans. 4. Masking hides distress. Competence bias invalidates it. This is the most dangerous combination. Example: an autistic adult says in a calm monotone, "I'm overwhelmed and I don't want to be alive." A clinician without autism expertise may think, "You don't sound suicidal. You're very logical about it. You're not in immediate danger." Why this is wrong? Autistic emotional expression often does not match internal experience. Result: suicidality is missed or minimized. 5. Clinicians misinterpret autistic communication. Without autism-specific expertise, clinicians misread literal communication, rigid thinking, slow processing, avoidance, shutdown, stonewalling, meltdown, anger issues, flat affect, lack of emotion, monotone speech, not distressed, difficulty describing emotions, lack of insight. Result: symptoms are misclassified as personality problems instead of autism or mental health conditions. 6. Masking during assessment leads to inaccurate diagnostic tools. Most diagnostic tools assume neurotypical communication, neurotypical emotional expression, neurotypical social behavior. Autistic adults often script answers rehearse, social responses use learned coping strategies, hide stimulating force, eye contact, downplay distress. Result: assessments underestimate autism severity and miss co-occurring conditions. 7. Competence bias leads to "you're too smart for services." This is especially common for autistic adults with strong vocabulary, high verbal, IQ, technical interests, self-awareness, ability to explain their symptoms. Clinicians assume you don't need support. You can't have an intellectual disability. You're too independent for services. You're exaggerating your difficulties. Result: people are denied disability services, mental health care, and accommodations. 8. Masking causes burnout. Burnout is misdiagnosed. Autistic burnout looks like loss of skills, exhaustion, shutdowns, increased sensory sensitivity, difficulty with daily living, emotional collapse. Clinicians without autism expertise misdiagnose burnout as depression, bipolar disorder, borderline personality disorder, regression, lack of motivation. Result: people receive the wrong treatment, which worsens burnout. 9. Masking is interpreted as dishonesty or manipulation. This is especially harmful for autistic adults with trauma histories. Clinicians may say, "You're inconsistent. You're exaggerating. You're not being honest about your symptoms." Reality: masking is a survival strategy, not deception. Result: clinicians distrust the patient, and the patient stops seeking help. 10. Why autism-specific expertise is essential. A clinician trained in autism understands masking is common and exhausting. Autistic emotional expression is different. Competence is not equal to capacity. Articulation is not equal to well-being. Calm tone is not equal to safety. Shutdowns and meltdowns are neurological spiky profiles. Our normal executive function disability is real. Trauma presents differently in autistic adults. AC and alternative communication must be accepted. With autism expertise, distress is recognized, symptoms are interpreted correctly, co-occurring conditions are diagnosed, support needs are validated, treatment is adapted, burnout is prevented, crisis risk is reduced. If you're interested in disability topics such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. I will talk to you on my next video.